This is Onesmus Blair, the Acting Executive Director of ENASO, a regional membership organization working across Anglophone Africa. What does ENASO do? ENASO normally strengthens the capacity of communities to meaningfully engage at different levels in global fund processes and national processes to maximize the impact of health programs. As a regional network, we normally reach out to civil society and communities with the right information at the right time to ensure that they have the right information to act, to advocate for real change, as well as to engage at the different levels. One of the critical things we normally do with communities is actually to support them, access technical assistance support to complement the gaps that they require in programming. At different stages, communities normally require assistance to be able to maximize the impact of grants. Now, ENASO normally brings together civil society and communities in regional meetings to learn and share from each other on what works and what does not work, and come together with solutions that are actually going to ensure communities are put at the center of the response. Now, talking about putting communities at the center of the response, there's been quite a number of initiatives globally. Good point in example, the Global Fund just released this new strategic plan 2023-2028 that strategically put communities at the center of the HIV, TB, and malaria response. But we also know that in their quest to look for resources to reverse the negative trends of HIV infection, TB diagnostics, and malaria, the Global Fund was unable to realize the 18 billion that they were actually looking for. What's the significance of this? Yet, in the new strategy, we are having new modules that have actually been introduced, including community-led monitoring. This indeed requires a delicate balance to ensure that priorities for communities are actually not left by the wayside as we are struggling to fit the limited budgets that shall actually arise as a result of the Global Fund not hitting its 18 billion. It's indeed a delicate balance, because the questions that are likely to be raised and that we should be aware of, communities are likely to be put on the spot and to be asked, do you want ARVs or do you want human rights programming? Do you want testing or do you want community-led monitoring? But this should not be the discussion of this or that, but a balance of how much do we apportion for commodities and how much do we ensure is apportioned for community interventions, because the two are complementary. You can have all the commodities, but if community rights and gender issues are not addressed, those commodities will actually not be utilized. There is need to ensure that there is sufficient demand created at the community, and for us to create sufficient demand at the community, we need community interventions to be adequately prioritized in the next funding cycle. Colleagues, ENASO is here to support communities, and as we are going into the next funding request for the Global Fund, we will actually be providing support to communities, linking them with the right technical partners to provide technical support in the Global Fund fund request writing process to ensure their priorities are adequately costed for, prioritizing the fund requests, and allocation necessary to ensure community interventions are done are adequately capped in the country grants. This is the only way we are going actually to reverse the trend of HIV, TB, and malaria and realize an end to HIV, TB, and malaria by 2030.